Good morning, good afternoon, and good evening. On behalf of RISE Institute and UNICEF, our partner for this webinar series, I am delighted to welcome you to today's webinar. Our series, entitled Fragmented Fields to a Unity of Effort for Early Childhood Development, the SDGs and Multisectoral ECD Monitoring and Evaluation Systems. And today's topic will be National Child Tracking Systems, Successful Systems of Chile and Colombia. I believe that today's webinar will be the first global webinar on this topic. RISE Institute focuses on child tracking systems as a part of our ECD and ECI initiatives. We see child tracking systems as a vital part of national ECD multisectoral monitoring and evaluation systems. When well designed, developed, and implemented, child tracking systems help countries to identify children with at-risk situations, developmental delays and disabilities, as well as with special health, educational, nutritional, and protection needs. These systems follow individual children over time to ensure they receive essential family-centered early childhood intervention and many other services. They also help us to identify needs, plan services, and expand budgets for children. They complement and extend comprehensive ECD multisectoral monitoring and evaluation systems. Our moderator for today will be Carlos del Castillo, a senior fellow of the RISE Institute. He works in participatory ECD policy planning, the development of national ECD monitoring and evaluation systems, and national and regional ECD research. Carlos is joining us today from Quito, Ecuador, although his home base is in Bogotá, Colombia. He will introduce our speakers. Carlos and our presenters will be speaking in Spanish. With UNICEF's great help, we are pleased to be able to offer you interpretation services in English, Arabic, and French. Please see your language options in the interpretation point below in the bar. After our two presenters speak, we shall have time for questions and comments. Please use the Q&A section to send us your questions. Carlos?
Gracias, Emily.
Thank you, Emily. Good morning, good evening for all who are connected from different parts. It is a pleasure today to have you on this webinar that basically to present certain points centering on what we're going to be speaking, the topic for the day today. Basically, the reflections that since many years ago, the countries had been advancing in their definition of their definition, such as infancy, early development, and what it means as far as the development for interventions to materialize that focus within the countries. And within this context, in order to follow up, many countries have been trying to strengthen their information systems in order to measure the progress of the countries as far as their reach in these interventions and attempts. But this focus is still sectorial, meaning the information systems remains as an information system as far as the education or health systems, and that is where they report. But today, and a little bit of the efforts that we're trying to do as we're trying to integrate this data so that we can better see the base of the children as far as a more integrated care. So today we would like to share with you two experiences that from our perspective are completely innovative experiences that already have a long trajectory. They are experiences that show how it's possible to integrate data that come from different services, different interventions that have to do with the development of early childhood, and show in an integrated way, the development and the reach and the care for the children in need. For this, we have two guest speakers, very important, and it's an honor to have them with us. On one side, we have Ms. Jeanet Leguas. She is the chief of the coordinator in Chile of Crece Contigo in the information department, and Ana María Peñuela also. She is a chief educator in the country of Colombia. Ana María Peñuela also leading this effort. So without much ado, I will give the word over to Jeanet Leguas so that she may share her experience, and later on we will have Ms. Ana Maria. So please go ahead, Ms. Jeanet, and thank you very much. Yes, hello, good morning to everybody who joined us in this webinar. I appreciate the invitation. It's a very important topic for us and all of us who are in public office as how to operate and to cross the systems to be able to monitor the development of boys and girls. I'm going to share the experience in Chile. In this case, I'm going to be sharing my screen. I think this is it. If you could, somebody please confirm that you're able to see my presentation. Carlos? Yes, we can see it. Go ahead. Jeanet, we are seeing it, but it's the other view. Would that be it? There it is. There you go. Perfect. Yes. Go ahead. Yes. So I am going to share with you the experience in Chile with regards to the early childhood monitoring system from Chile Crece Contigo, which is the integrated system that we're following in our country. First of all, why a system of record, a registering system that allows us to follow monitoring children's development? First of all, the monitoring of children's development requires a coordination between various sectors. When we intervene into certain situations in which the boys and girls are and their families are in finding themselves in, we need to we have to do with living and health, education, all these different segments. And the characteristics of child development require the opportunity and relevance in the provision of services that cannot escape us. We need that through these systems, all the derivatives, all these references and counter references are timely and pertinent. Another reason for this, for the register system, the record system, is because there are different case management at the local levels translated to permanent data transaction that must be communicated in a timely and accurate manner. We need to be able to know what is the level, for example, the development of the children, how many children there are with delays in their development, how many of them need some kind of particular intervention. All of that we can receive from the system. But if there is no system, then we are blinded against the situations in which they may find themselves, the boys and girls of a certain region. And of course, if we extrapolate that as well into a national level, and it would prevent us from being able to take national decisions, more centralized decisions when needed. We also need to generate traceability of families that are inside the program. And when we're talking about traceability, we're referring to follow-up with regards to the conditions in which the families find themselves, the access that they have to the services that are provided, that are available in the system or in person, so that they can and also we need to see how the families are developing with regards to the situation. So, and that's what I'm going to share with you, what information we have within this base that allows us to know, to learn in real time what is taking place. So here in Chile Crece Contigo, in the program, we have a system that is called the Registration, Referral, and Monitoring System, SRDM. As the name mentions, it not only allows us to register the boy or girl, the child, but we can also refer to a certain service and to monitor what is happening with that service, which later on I'm going to explain a little bit how it's structured and what are the profiles and the information that we have in the base. The objective of this system is to monitor and make a personalized follow-up to the trajectory of the development of the children from the first control of conception until the conclusion of the first cycle of basic education. So that would see they are 4 years old. Chile Crece Contigo extended to 9 years old. We also have modules that allow us to follow specific follow-up for children that are older and that enter services that are more considered for that segment of life, which I'll explain as well. The objectives of this system of registration, referral, and monitor, first is to register and monitor the development process of children from conception as shared, and to start generating the necessary alerts that are activated and that of comprehensive actions and benefits that favor their optimal development, that are part of this platform for their, again, optimal development. On the other hand, it also activates and monitors the management of Chile Crece Contigo intersectorial actions and benefits of a more universal nature and differentiated. So it's for all children. And another one that is the differentiated, which is for specific cases that require boys and girls and their families to take care of a much more specific case. For example, some kind of disability or a need to access a mental health program, for example. And then to generate knowledge to optimize the follow-up of cases. In order for the follow-up of cases, the management of regional networks, and the efficient use of resources in the implementation of the comprehensive child protection system. To be able to visualize how it's evolving, the story, the trajectory of that boy or girl that we are following up there. If we're not managing the system for this purpose, we're working with the regions, which are those that accompany the communes, the groups, and we provide them with tools so they can manage the information. And I will be sharing some questions that we ask them so that later they can use the reportability that the system provides them within the system. An important aspect that has to do with the normative aspect is that there is there's a law, which is the 20.379, and this law has a particular regulation that incorporates 27 articles, which is the system of regulation, referrals, and monitoring, which is a system that's going to allow them to register for benefits. It's going to manage the guarantees, the preferential access and claims, technical assistance, which is, these are all guaranteed by law. So this is going to be the tool that's going to allow us to manage cases as well as analyze. And at the bottom, to have all that reportability of the statistics of regarding what is going on in the different regions.
Se puede decir como la estructura de lo que contiene el sistema de registro. Ustedes pueden ver en esta como redondelita verde. You can see what is in the green, what allows to register for the expecting mother as well as the children. That's the first checkup. And then also there's contacts, and that is registered in the platform. And then there are going to be what we call
S-
Y
Uh,
las pautas van indicando si
those would be
cualquier
guidelines for
cualquier
social.
tipo de riesgo
And then if
debe
there's any
ser
kind of
definida
risk
al
that
momento
is
que
going,
se encuentra en el
that or
proceso.
any kind of service that is being
Por ejemplo, las
provided,
visitas domiciliarias
so there is
iniciales,
going to be
también
comprehensive visits
y
and workshops,
talleres prenatales, por ejemplo, en el caso de las gestantes,
prenatal workshops, for
y otros
example,
tipos de talleres que se
and
realizan
other
en
types of
familia.
workshops for
Y luego
kids.
se finaliza el proceso una vez
And
que
the
puede
process,
dialogar para
once it's
poder
over, once
acceder
the
a una
child is
atención
able
médica.
to access other services.
Dentro de la historia de nuestra plataforma,
Within
queremos
the
contarles
development
que
history,
Chile
we
Crece
would like to tell you
Contigo
that Chile
nace en el
Crece
año
Contigo,
2007.
it's in 2007, and the registration system, it started in 2008. There was 1 year of preparation in IT, and then in 2009, and then there was a parenting model that was incorporated. And so every year we add modules. And so that would be, and we would be opening different services. And that takes us to this year, 2023, a redesign of the system. And we had to rewrite it from an IT perspective to make it the most efficient for the users. And we are throwing it, and what we have is to integrate or connectivity of the data between the different platforms that are outside of the ministry. For example, with education, with housing, and with other sectors, which allow us to get data and which favor the laws that we have for children and their families. The system, it has profiles. What does that mean, profiles? Those are the different sectors that are incorporated in the platform, and there is somebody who is representing this sector in the neighborhood. For example, there would be a point of contact in health, in education, in social, in the area social. Those are the subsidies, access. For example, services, food, any type of actions that the municipality has. There is something for housing, and the way that there are processes that were done for subsidies. There is also a municipal labor information office, and that is if someone needs to look for a job, there is an office, which is called the OMIL office, and you can go to that office and apply to a job and also register in that platform. And there is also disability for children who need any type of specific care. And the RSH, it's social, that is their abbreviation for Social Household Registry, and which allows Chile to measure the vulnerability of families. The profiles allows to that allow to manage alerts, everything that includes these health services, province to the region, and as well as centrally, is only visualize what is happening in the territory and what is generating the alerts. And that is for the management. So if there is a referral to a program, and so the child that is there, they're going to register in the platform. And I would like to show you here what there is here in the background. That is the action management cycle. And so there are alerts which are not managed as the red. For example, if a child needs to go to kindergarten, when the alert is generated in the territory and nothing is done, then it stays as not managed. And so that is this red circle. And so in the way that there are references, in this case, it would be education, it will be changed. The state will be changed and the monitoring will continue. So for example, when there's an alert generated to access when kids are really good, when they are really young, when they are between 3, 6 months and 2, and most families, they prefer to care for the family and no put them in sala una. And so what they say that I still want my kid to enter, and it does not correspond. There is a state that we call it that is not resolved, and that means that when a child is referred, but there is no space to find them, and so that would be not resolved, or that is a pending status. And after that, and once it is resolved, and once the kid is going into Sala Una, it would be the educational sector. It would be in the first place, and then it would be go into the status, resolved status. And so from the regional area, these are the states. How many alerts do we need to resolve? What are being monitored? What has been resolved? And that is how we manage the neighborhoods so that the resolution percentage go up. The goals that I was mentioning at the beginning needs that everything happens to be able to take advantage of the opportunities and so that they can take advantage of the developments and take advantage of the services that they need. And so we have a reporting blog, that is a picture of a family who is in the health room, and there is a screen where the reporting screen shows up, and what the neighborhoods do, what the central and what the regionals do, how the resolution percentages are and how they're going up, and they are different in the background to not be mixing a template, but that we go grouping them and registering them. So for information management, what we do work at the regional level and as well as the neighborhood, the alerts in the neighborhoods, training them in terms of the use of the data and the evidence as well, which allows us to make decisions and incorporate different services that they are requiring. And so we interpolate with a question. So know which is the change model of the program, which services do they provide, the quality determinants, expected results, control number, what needs to happen when the material is submitted, different types of health checkups. And so we need to know that and have that in mind when we have the information. Do you know what data and information you have? Do you know basic information, exploration, and reading techniques? And these questions are going to go with the trainings, obviously, and have know how many teams know about the information of so that we can be able to provide the appropriate training. Do you know how to use it for management? Know how to ask questions and get the answers for those. And over the years, we've been able to have very good progress in our team and analyze the data. Sometimes they send it to us questions, and sometimes we have it in the data extractions. And what we do is we play with the data. And so it is also a system that is progressing in the teams, and we ask for more specific information to be able to manage the data and be able to analyze and interpret the information. And so I would like to talk about the lessons learned now in terms of the platform and let you know that before starting IT developments, the applicant should be clear about the service provision flows. And so that would be identify the family's contacts with services in the territory. For example, we don't get anything out of a whole bunch of alerts. So what we need to do is we need to identify the services to decide which alerts to generate and then have a course and an answer. And so what we have, that there is no service that is provided. For example, there is to have this information, this data, to be able to ask for, to create a new program. And so basically we need to give the available programs for the territories. And then after that, we need to establish what information is captured in these contacts. So for example, in Chile, we have an ID, which is a number, it's a verification number, which is called Rol Único Nacional, which is national unique role. And so we capture the data from the corresponding civil registry to know that the person who says that they are, and what are their names, what is their address, what is their last names. And so this type of data is going to be captured and what we can do with the data. And what are these data? And it allows us to identify the receipt of this alerts and what action should be taken to resolve them and what we need to do to resolve them. And so, for example, if there is an alert for a certain family, in that family, I need to know, for example, where to refer them to, the type of program it is about, and intra-family. And this program needs to know that to be where in the reference circuit. And so when the case is received, and so we would also need to have that they are essential, the data. So Jeanet, if we could close please soon, thank you. And so I have one more. So if it is necessary to have the essential data to be able to incorporate it, and so it needs to be documented before doing development. We cannot start development, which has happened before, and then halfway through, we say that, oh, we would have liked to incorporate this other module that we didn't take into consideration at the beginning, and because the background affects the platform. And so really the applicants, they need to document their expectations in the interfaces in the platform. And to be able to have in the system, it needs to be used for what it corresponds with. And here's some data before we start. The information that is captured must be associated with the identity of each person. Identify if the required information exists in another state, IT platform. It is also recommended that the IT system has resources not only for its design, but for its permanent improvement, and the system must have
también este sistema debe contar con las garantías
guarantees on the security of personal information to protect from leaks.
tiene datos sensibles de niños y niñas, por lo tanto hay que resguardar también.
So
And
we
so-
also have to take care of their own safety. So considering time, I haven't brought exactly like the data, statistics, and numbers. I can share that at a later time, but basically that is the experience that we've had at Chile with the use of systems of monitoring and registration, and I hope it is of great value to you. Thank you. Thank you very much, Jeanet, for sharing this very interesting experience. It's quite inspiring. And now we're going to give Ana María Peñuela the opportunity to speak from Colombia so that she can share their experience. And then we will open up the space for questions. And we remind the participants that if you have any question, you can share them through the chat so that we can continue on then with our speakers. Ana María, please go ahead. Hello, good morning, everyone. Are you able to see my presentation now, Carlos? Yes, go ahead. Yes, perfect. All right. So first of all, thank you very much for the invitation. For us, it's a pleasure to be able to share with you the advances from Colombia, a country as well that has advanced a lot, such as Chile. So we offer this presentation, this first part, and the second part, and María Peña will be the other person that really has her heart into this whole process. So this is the content. We're going to start talking about the building process, the normative and conceptual framework of this monitoring system, its structure, the operation, the information that's generated, the use of this information specifically in the management of generated alerts, and the biggest challenges that we're facing at this time. It has been a process that's been very long, very consistent through the time within our country. It has a history from the last decade that started with the definition of the theoretical and conceptual framework, and which created a public document, national and international, which is the policy for technical and managerial foundations for early childhood. That same year, there were several other advances, the identification of available sources of information, which allowed us, with that source of information, we were able to determine exactly what we were going to be following up, as well as the information system. Then the following year, the development of the information system. The next year, the agreement with entities responsible for reporting information, as well as the start of the information reporting, which was not only the keeping in mind how sustainable it needs to maintain itself. Then finally, the definition of the regulatory framework, which turned into the law 1804, which is from that we create a particular regulation based on this policy, which has to do with the monitoring and evaluation. Decree 1356. In the last couple of years, we've had an expansion of the follow-up and prioritized care, leading to the National Development Plan. We have 4 years of a government period. So every year, the year that we need to do it, we do this expansion and follow-up, and we make improvements in its different functionalities and features. What are the agreements and definitions that we've created? The first agreement is the conception of a boy and a girl, the definition of conception. And then based on that, how do we determine the conception of integral development? The achievements to achieve its integral development. What's the structure to define that integrated care. For example, nutrition, feeding, initial care, art, cultural participation. Then we created a definition that's very important for our country, which is the early childhood learning, that has to do, which involves all the specific cares during early development. It's a national agreement, but only the practice as far as where the children live, which is what we're monitoring, which is that smaller, which is for us is the municipality that we are monitoring the children in these different municipalities. Then, so we're now at about 100 cases, and we are following up on those as far as prioritized care. So that is the Comprehensive Early Childhood Development Monitoring System. What is it? The Integral Route of Attention of Care, RAI. This is a tool that contributes to ordering the management of comprehensive care in the territory in an articulated manner, consistent with the situation of children's rights, with the offer of services available with characteristics of girls and boys in their respective contexts. So based on that definition that we created of what is a boy or a girl and their development, that conceptual meaning of development, and the care that goes into each one of these different structures that I've mentioned, that's how we develop the integral cares. And that allows us, child by child, to see how that integrated care is behaving. So what is the process? First of all, we need the birth certificate. So we need, but we need to make sure that they have that birth certificate, that they have an up-to-date affiliation, healthcare system, that they're within the system, that they have their complete vaccination record. We need to make sure that all boys and girls have the growth control, the development, that we're able to quantify it. We also need that they have nutritional follow-up to make sure that they have the classification. And what do we know? What do we have to do specifically as far as their nutrition? These are the boys and girls that participate in information system, to make sure that they have access to books and specialized learning material, as well as the nutritional education, especially when they find within an education system that is either institutionalized or not. We have to make sure that they have the teachers that are following up on their own educational process as stipulated in Colombia, to make sure that they are in appropriate development environments, their interactions amongst themselves and amongst their environments, and that they have recreational activities as well, that they enter early childhood development as far as integrated educational systems. So we're focusing on these 12 different aspects. What is the framework that supports this? Obviously, that construction process that I mentioned, those first 5 or 6 years, after that we created the state politics. And there's one article in particular, which is the line of action, which is the monitoring and evaluation of the state policy for the integral development of early childhood from 0 to always. And that's where we mentioned specifically the monitoring system for integral development of early childhood and the unified system of information for children. And it also has another proposal. It's an agenda. It's a permanent agenda of evaluations. Particularly for this ministry, we're giving them a structure and implementation for the comprehensive development of monitoring system and the quality management system for initial education modalities. From this, the the decree that you're seeing here, number 1356, it allows the comprehensive early childhood development monitoring system. So again, the definition of this decree is it's the comprehensive early childhood development monitoring system in an information system for the nominal follow-up of children in early childhood, through which the care provided from pregnant women for early conception to children in early childhood in the country is recorded and monitored for their integral development. Who are the responsible parties? And for reporting, obviously, it's the entities of Intersectoral Commission for Comprehensive Care of Early Childhood. So that is the institutions of public or private nature, territorial entities that have their own offer of early education, National Registry of Civil Status, and the family compensation funds as well. Basically, in summary, all of these that have the information to report is, so all of these parties, all of these groups, what they are reporting is the information on the characterization of children, information on priority care, information on monitoring the integral development of children, training, qualifications of human talent that attends to early childhood, national and territorial management, public and private entities. At this moment, I'm going to give Mari so that she can speak and explain the follow-up system and integrated development for early childhood. Thank you very much. Thank you. Hello, everybody. So in this slide, what it's showing us is the different information sources from which the system is being fed. All the entities that appear here, each one have a lot different information systems. And what we're doing is to take those sources that already existed in order to consolidate them and say that we have a unified base of the systems of the database and the different care services that each one of these are providing. So we have basically a curriculum, basically from birth, where they were born, where they're receiving health services, where they received their vaccinations for every child. So basically, it's like the curriculum, it's like the summary of life of a child. Basically, at the end, the system allows us alerts of those services that have not been reported, that the child may not have received. And when the children are 5 years old and start to enter first grade, the first mandated is that transition period, we had those alerts. It's el paso a SIMUAC is in how it's called, SIMAT, which is the early childhood development in Colombia. So basically what we've created is a database of all boys and girls, and based on that, they report the services, and what is generated is information of what has been achieved. Then we can manage the different services to guarantee that every child is receiving whatever they're missing, and it's updated within the system. Also share with you that all the way from the beginning, since 2015, when we created the first chart of information, we started out with 963,040 children from ICBF, which is a service of initial education. Then we started incorporating other organization children in order to build from 0 to 5 years old. So we have all the children within the country. So what we're seeing, according to projections of the census, we have in the country about 4.7 million boys and girls, and closing 2022 will have 2,860,000 children within the administrative registry that we have consolidated from the different bodies, and this corresponds to 61% of total population. So we haven't completed that whole universe of boys and girls for follow-up.
And so there's the accumulation of data since 2015, where the kids that are older than 5, that are over than 6 years old, 5,837,000. There are who are more than six years old and to have comprehensive care. And so some of the data that is generated from the system has something to do with the objective that the country has and to progress with the childhood development. And so we have, since the year of 2010 until 2015, consolidating the tracking system, where from 2018, 2019 in the education system, and taking into consideration the care that preschool kids have. In the new plan for the next 4 years, we have an objective to get to 2,700,000 in terms of the framework. And that is a objective that is that we have the Ministry of Education and the childhood. And so starting with measuring in 2023, how we are advancing. And so this is a graph in terms of the follow-up of the care that we've been giving. And so the affiliation, the identity document, it maintains a constant behavior, but there are other that has had variations for the changes that we made in terms of the institutions, in the measuring, in the entities, reporting entities. And so what you see in the last column, and so this is where they get 6 or more priority care. And so that is when we have, during the measuring period, they have received of the 2 attentions of the care that they've been attended to 6 times or more, where they get comprehensive care. And so here there are some graphs that have to do with the concurrence of the education. And so these are one of the indicators that the company, that the country promised on. And so in terms of comprehensive care and indicators. And so we have roles within we have a user manager, we have the different indicators that are being reporting, the type of quantity of data, and the ministry with the indicators. They make reports on the data and they continue with follow-up, secretary, the department, and in the country, that is in the municipality, where at the end there is the users, the population, the children, the alerts, the different, and so we verify the data from a national standpoint, the planification of the resources that are needed for service. And then here are some entities and users who are the people who can access the data, because it is detailed data where the kids' parents are, who they are, where they live. And so there is some information that they can consult if they need to find that. And with this, the use of data. There is work about identifying who is the person, how they can use the information to be able to effectively give them the care that they want so that they can. So we need to define procedures, internal for the people who are designated with their competencies and what their responsibilities to be able to manage the output. In terms of what you do after, so we identified the alerts by sectors and the outlook for care for children and the documentation of these management, what exists in the territories, in the intersectorial table of childhood and adolescence, and finally strengthening and update the data. In terms of the biggest challenges, the challenges that we have had in the system, they have to do with the lag time in reporting of data, the production time, the consolidation time, the reporting time. And so that is, we have had to align those with the semester because there are consolidated information in the reports to be able to have that, the quantity, and then in terms of the data quality, the efforts that we've done for the quality of the data to be putting into the system, having data availability. There are different activities that the entities do, but it is not one-to-one what is required to be able to do a nominal follow-up, and the incorporation of new data sources to have data that is with characteristics in terms of continuity, availability, quality, and those are the types of efforts that we've had to do in the entities, in every entity, and to be able to complete the universe of children's. That is a theme that requires that we have one-on-one information, one-on-one data, and adopting the system with the players involved. And so that would turn into a tool for the work of everyone, all the managers, all the people, and all the care. And so that is the challenge, to designate people responsible, people in charge in terms of the responsibility of care. And the data production, the sheer amount of data that we need to report on and analyze so that we can make decisions in order to manage the rules, and as well improve and incorporate functionalities into the system so that we can have better information, better data for all the entities. And so at the end, we have some technical support. We are 4 people on one team who we are in charge of this data system and all the data published, the open data, the manuals, the information that is available in the Ministry of Education portal. And that would be all. Thank you very much. Thank you very much, Jeanet, and for both presentations. They show us an important innovation process, and those are also sources for countries that are looking to have this type of initiative. I have a specific question. A key for closing is that with the different what I've gleaned from that both systems from the very beginning that they have comprehensive development, comprehensive care. It's been very clear at the beginning, and also every system defines in a very clear way the pair of the services that are provided with Chile and Colombia, Chile Crece Contigo, and so what is being proposed and what is being followed up is very clear, and that they separate very clearly the framework, the regulatory framework is very clear, and the most important, it's very clear that every system, they are centered on children. And we can show that in the trajectory that we have been able to progress with the access, the services that are provided. And it's even clearer that both systems are able to generate alerts so that in the territory, in the local, that it is being managed every kid so that they can progress in terms of their comprehensive care. And so in this context, I hope that I've given justice to get all the points from both presentations. And so a question that I would like to ask you is that that we see in both cases, both systems have long trajectories that has gone beyond 3, 4 governments. And so it's very interesting to see it going from now. And so the question concretely that I would like to ask both of you is, what are the essential agreements, because both systems, they have intersectorial, and so it's we need to be able to do it within with all the different sectors that are within the system and not just one of them. And so I would like to ask Jeanet and Amalia, what are the essential elements that you would consider are there in the political agreements that have allowed that the systems not last, but that it's strengthened through time, so that both systems within the government changes and that type of thing. So Jeanet, I would like to pass the word to you. Thank you very much. I believe that in terms, we could say that legal, political, in terms of Chile, below the law and where it is established that the system of follow-up system, we're going to continue monitoring. It is a starting point. I think that it's very important in what you have shared, the more use of the political agreement, and that would be using the platform, and which way giving reports to these teams, and when a action is carried out or not. For example, it is diffused, and sometimes that there was an alert that was generated for the case, but they were never referred. And so using the platform, adding the data for the kids in from the logics, and so the implementation of the use of the system training. We have a WhatsApp help systems that we work on every day, where they ask questions and we go and we answer them to be able to facilitate the use, and also to ensure the fidelity. And we've been doing this for a long time, and it is not 100%, and so it's daily work, and it is shared between law and usability of the system.
Muchas gracias, Jeanet, por tu respuesta.
Thank you very much, Jeanet, for your response.
Amalia.
Amalia, please go ahead. Well, I think that in Colombia's case, definitely the political commitment by part of the governments to be focused as to what is going on from the beginning of the trajectory with the children, that would be the fundamental factor, the most important factor. The normative political aspect is what has allowed it to continue throughout time. But beyond that, each one of the sectors also has within their internal proposal, education, health, each one of them has this commitment, because that the system is showing us, what it has allowed us to do is that each one of us are more conscientious. We are more aware of what's going on with the children. On a dashboard, we have indicators that are showing us their actual situation, and that has propulsed us, that has pushed us to continue, that each one of the boys and girls, that the children have the best conditions, that they receive all that we are committed to providing them for in those political documents and those in the concept that they actually occurs. Make sure that it happens. So it's not only on the political side, but but technically as well, to have that commitment that we initially set out for. Perfect. Thank you, Amalia. I'm going to take a question that we're receiving in the chat for either one of you or for both of you. The question says, well, how would it be possible only to the provision So the question again, so with regard to the Sustainable Development Objective 4.2.1, assuming that the occurrence of services per individual child is guaranteed as optimal or appropriate in their integrated development. So how, not only ensure that this is taking place, but how do you make sure that it is, as it is intended to be? We have a module and a service which are interventions that are showing some kind of delay in their development. So we have the diagnosis. So the modality would bring in that child once they receive the intervention, and then there's an exit exam, and that exit exam or test will let us know to what percentage those children are recovering. There's actually a goal that to follow and to report every 3 months as to how is the recovery of the children that are showing some form of developmental difference or delay. It fluctuates between 60 and 70%. Depends on the year. During the pandemic, the number was lower, but at this time, we're closer to 70% of recovery of those children, because, of course, there are certain services that you can refer, and there's not much you can do if you don't know what is the result of that action. So we're able to monitor in certain cases, such as this one, the example that I just provided. If there's some form of some change in their development, the complication is that the nurse that provides the early evaluation needs to also provide the exit evaluation so that it's more permanent for those cases that are pending that reevaluation, so we can, better see that final result and where they stand. But we have seen great advances within that segment, so that they can follow up, with that exit evaluation.
Amalia, ¿quisieras agregar algo?
Amalia, would you like to add anything? Yes, in our case, we have certain steps. One that comes from part of the health sector. In the integrated evaluation of health, we evaluate their development with what has more to do, not so much associated to what the ECVF would measure, which is more qualitative, but rather, what the teachers are observing in the classroom with the boys and girls. So there are certain measures that are taken with certain specific, objectives. So it's a one-on-one measure that guides certain actions that need to be taken in the health sector or the early education sector with the teachers or those individuals that are with the children, so that they can adapt their pedagogical curriculum, because this scale is going to show that they're going to have some form of delay. So we have these measures, but the country has to improve as far as more of a national measures, so we better understand the development of children. There's also been some development with the quality of early education, but we have to continue working in order to define a proper measure for the country that will better show advances in development.
Perfecto, muchas gracias.
Perfect. Thank you very
por
much.
tiempo voy a hacer la
I
última
think
pregunta,
I'm going to
porque
ask the last
también,
question,
la
taking
sala de chat
timing,
tenga una pregunta
unless
adicional.
anybody else in
Entonces,
chat has any
la
other
pregunta
questions.
es,
But the
eh,
question, Jeanet, would be,
recientemente, digamos, en los últimos tiempos, pues,
recently,
la situación de emergencias en los
the
países
emergency
ha
situation
venido,
within
se
different
ha venido
countries
incrementando, digamos,
has
todas las
increased.
movilidad
All different
humana,
types of
desplazamientos,
emergency, mobility,
la
displacements,
pandemia reciente,
the recent
situaciones también
pandemic,
de conflicto
conflict
armado,
situations,
crisis.
armed conflict,
Entonces la
crisis.
pregunta sería un poco cómo
So the
estos
question would be,
sistemas
how do these systems,
con el tiempo, digamos, se han
with
podido, se han
time,
venido
have they been
adaptando
able to
para
adapt
poder efectivamente hacer
in
un
order to
seguimiento y poder
effectively
comenzar a darle una
continue that
mirada
follow-up
específica
and
a estos niños que están en
a
esas
a
condiciones de
more specific
emergencias,
look that are in these
pero también,
emergency
digamos, hacerle
situations, the
un
children in
zoom
emergency
particular a
situations,
esos niños
but
que
to
tienen
zoom into
con
those
discapacidad,
children
con condiciones
with disability,
digamos, personas
with
con discapacidad que también usualmente son como los que
that
después de
usually,
las emergencias
generally,
terminan afectando
that's
aún
are
más.
who
Entonces,
any kind of emergency is going to
la pregunta es
affect
como doble.
all the more. So it's a double
Cómo los
question, but
sistemas,
really,
ambos sistemas
how
se
do
han
the
venido
system, both
adaptando
systems,
efectivamente
how
para
have
poder hacer
they
seguimiento
adapted
a
in order
esas
to
condiciones de crisis a
monitor
las que
those
los
crisis
países están venido,
conditions in which
recientemente?
both countries
Y la
have been
segunda
facing
es,
recently?
¿cómo
And the
se hace
second
como
part of the
una
question
mirada
is,
específica
how
también
do you
a estos niños y
more
niñas
focus
con
those your view
diferentes?
of those children as to how do they overcome these
Bueno, en
crises?
temas de
Janet.
emergencia, nosotros
So as
tenemos
far as the
un
emergency
material
goes,
específico que se
we have
provee a los
specific
niños y niñas.
material that is
Lo que
provided to
hacemos
the
es gestionar
children.
todo a través
What
de
we
nuestras
do,
regiones
it's
y
regional.
no hay en sistema algo que marque, por ejemplo,
We
alguna
don't have within the
situación
system something that marks a
en el contexto de
particular
una
case
emergencia.
in the
Eso no
context of
lo
an
tenemos
emergency
todavía
per child.
considerado.
We don't have that consideration to date.
Pero claro, es vital
But
porque nosotros
it
a
is
través
vital
del
because
instrumento, o sea,
through the tool,
del Departamento de Estadísticas, que es donde
the
está
statistical
la tributación
department,
social, lo que se aplica
where we have this civil
una
stratification, what we're
ficha de
doing
emergencia y esa ficha sí nos permite saber
is an
cuántos niños son
emergency
afectados, quiénes
report. So how many children, where are they, are being affected? Who needs help? But it's not in our registration system. It's in a different system that the ministry has. So that's where we start talking about their system, right? That they're all divided, that they're all recollecting information, and it's not crossing, right? But with regarding children with disabilities, we do have a manner to alert, when a child has a disability. What is not taking place, and it should, is the direct cross-reference. The system that accredits, that evaluates and accredits the disability. So it's basically an auto-reporting route. Household psychosocial risk is an auto-evaluation by part of the family. So they are auto-reporting. We have certain sectors, for example, where she says that she has a visual disability. And when we ask her, what's the diagnosis? Because I'm using glasses. So it's very important to have some form of training in order of the professional that is providing that care, because using glasses is not a disability, but blindness is. So we need to discriminate, know what is and what is not a disability. And that allows us to providing results to children with disability to have a guarantee as far as technical assistance. And we have technical assistance, for those needs, specific needs. But these little things still happen as far as that families think that it's a disability, but it actually is not. And that's where the professional, the health professional that is going to be seeing that family, that needs to clarify that, distinguish it. Thank you very much, Jeanet. Amalia. Yes, we have some variables to determine if it's migrant children, mobility, internal mobility victims, if they have any kind of disability. Our source of information would be the Ministry of Health through the evaluation that they perform. And in the case of migrant population, for their access to educational system, we have found some children that we identify in a household. When we go to look for them to enter the access to the system, we don't find them anymore. We have a lot of children that are in transit, and we've been able to identify a population that is moving throughout different departments, or they enter and exit the country easily, as well as many others. Where honestly, we have been able to increase the number of migrant children that access the at least the educational system. And what it has to do with boys and girls with disabilities, to be able to have this prior identification of children lower than 5 years old that are entering the education system, we generate a report of candidates that are about to enter the educational system. And to have this identification, if the child comes with some kind of a disability, it allows the Secretary of Education to prepare the conditions that are required to receive these children in the different educational establishments. So it's been very valuable to be able to count with that information to, to make all the preparations of the care that they're going to need. Thank you, Amelia. Carlos, Jeanet, I'd like to add something else. As far as migrant families We use platforms such as Route Zero, and it's similar to what my Colombian colleague is mentioning. When we're looking for that child to do some kind of, provide some kind of service, the child is no longer there. And we have devices in the different areas where the majority of migrant families are located, where we provide specific services for those families. What the complication is to be able to recover that child when they move. We don't know whether they entered or did not enter education in a different region, different commune. Because they're not in Route Zero, they only register manually the name. So you can find the same name spelled different ways, written different ways. And it's very difficult to know which is the correct one. So we're trying to work on an ID, on a permanent ID, as we're trying to regularize this situation, and that route, that identification will be permanent, will follow them permanent. And that way we'll be able to trace these migrating families. Perfect. Thank you, Jeanet. I don't see any other questions. I think, keeping time in mind, I think we're going to close. Just to conclude, that these systems are facing great challenges with regards to population in emergencies because of mobility, the difficulty that exists in having a permanent ID number, that allows us to follow up, to monitor with their mobility. What I'd like to highlight finally then is that both systems, the response that Amalia and Jeanet, they have a very clear dedication to transform the children's lives, to be able to have a reading of every child, to be able to find them, that they're able to manage, between all the different sectors, the services, the care that they are needing to guarantee their integral development. So having said that, I'll close. We're, it's 17 minutes past. So, but thank you very much, Amelia, Ana Maria, Jeanet, to stay with us a little bit longer. We've been, the presentations in English have been requested, so we're going to try doing what we can to translate the material to English, to share it with all our participants today. And without saying anything much, from the Ministry of Education from Colombia and Chile, Crece Contigo, thank you so much for participating in this webinar, in this talk that inspires all of us to advance in this process. And that's it. Thank you very much to everybody for joining us. If you have any questions, you can write us in the emails that Emily has provided, and with UNICEF as well. Thank you very much, and everyone have an excellent day wherever you may be located. Thank you very much. Thank you, everybody. Goodbye.